Hi, my name is Dr. Gregory Guyton from the MedStar Orthopaedic Institute. I'm a board-certified orthopedic surgeon specializing in the treatment of conditions of the foot and ankle, from the simple to the complex. Foot and ankle problems always involve a combination of some traumatic injuries and some that are just degenerative in nature. And some traumatic injuries, like an ankle sprain, may turn into ankle arthritis or other problems down the road. So it's very common that trauma sets things off, but then many times we also deal with conditions that are simply degenerative or congenital in nature. I work on a lot of patients who have neuromuscular problems. I work on a lot of people that have flat foot problems. And then, of course, I do a lot of arthritis that comes into play with older patients. And I will go down and see younger patients as well, patients as young as 8 or 9 that have adolescent foot deformities. I'll see many of them as well. Another exciting development that we're actually at the forefront of here is working on minimally invasive ways to do some of the surgeries that we've done through traditional open means. There are 2 examples of that. One would be doing tendon reconstruction through small incisions, and that's actually a particular focus of mine. The other is a philosophy of minimally invasive surgery on the forefoot. So there's a lot of interest in doing minimally invasive bunion surgery, but it's been largely focused on easy bunions, the kind that it really wouldn't matter that much if you do it minimally invasive or open because the incisions are relatively small either way. What we're trying to do is to start doing larger bunion surgeries for very severe deformities. And that involves a procedure called the Lapidus procedure, which we've been doing through a minimally invasive approach. That combination is fairly revolutionary, I think. It involves using small incisions and using a very powerful small rod as an implant in order to achieve dramatic correction and do it with a great deal of strength that allows the patient to walk on it virtually immediately. That's a real revolution in care to try to take care of some of the most severe deformities of the forefoot in a way that's much easier on the patient and involves a much faster recovery. The percutaneous Lapidus procedure using that nail that allows early weight bearing is unique to us. It's a procedure that we pioneered. I went into medicine largely because of the draw of science, and that's what I think gets a lot of us into it. After you're into it, you realize that medicine is a way to combine science with humanity. And the reason you stay in medicine is because of the interactions with people. You go in for the science, you stay because of the people.